गवर्नमेंट ऑफ इंडिया ने शुरू किया एक महाअभियान ट्यूबरकुलोसिस के खिलाफ। आज के दौर में भी भारत में ट्यूबरकुलोसिस यानी टीबी से हर 3 मिनट में 2 लोगों की जिंदगी छिन जाती है। इस सिचुएशन को बदलने के लिए एसोचैम, सेंट्रल टीबी डिवीजन और मिनिस्ट्री ऑफ हेल्थ एंड फैमिली वेलफेयर ने लिया एक इनिशिएटिव और न्यू दिल्ली स्थित होटल हयात रीजेंसी में एक कॉन्फ्रेंस का आयोजन किया। जिसमें ट्यूबरकुलोसिस अवेयरनेस, प्रिवेंशन एंड वेलनेस प्रोग्राम को लॉन्च किया गया।
A very warm welcome to our today's program, Getting to Zero Death, the Tuberculosis Awareness, Prevention and Wellness Program.
इस कॉन्फ्रेंस में आए सम्मानित अतिथियों और पॉलिसी मेकर्स का स्वागत करते हुए चेयरमैन नेशनल काउंसिल ऑफ हेल्थ केयर and hospitals, एसोचैम and ex-chairman सर गंगाराम हॉस्पिटल के डॉक्टर बीके राव ने कहा,
We all know that early diagnosis, complete and effective treatment of tuberculosis are the cornerstones of tuberculosis prevention and control strategy. Ironically, again, majority of tuberculosis cases are never diagnosed, still less get correctly treated. Inappropriate diagnosis and irregular or incomplete or both treatment with anti-tubercular drugs contribute to complications, disease spread, and emergence of drug-resistant tuberculosis. To ensure compliance, the Government of India has started a revised National Tuberculosis Control Program in which the internationally accepted DOTS strategy is used. With the objective of achieving zero deaths due to tuberculosis in India, ASSOCHAM, in collaboration with the Central Tuberculosis Division, Director General of Health Services, Ministry of Health and Family Welfare, is initiating an awareness and preventive health care program by organizing camps for workers at industrial sites.
एक बड़े चैलेंज को पूरा करने के लिए आयोजित इस कॉन्फ्रेंस के कीनोट एड्रेस में मिशन डायरेक्टर यूएसएड इंडिया मिस्टर जॉन बीड ने अपने विचार कुछ इस तरह व्यक्त किए।
I'm extremely pleased to have the opportunity to join what I think is a very important gathering of actors on the critically important topic of addressing tuberculosis and this event entitled Getting to Zero Death. In TB, I think we see the impact of the Government of India's commitment to addressing the disease more robustly. I will just quickly outline some of the really notable empirical gains and successes in the area of TB, energizing case detection from 30% to 70% while maintaining a core rate of 85%, all within a decade of the government's TB control program, setting up over 13,000 diagnostic microscopy centers, diagnosing and initiating treatment for over 1.5 million patients per annum.
इस कॉन्फ्रेंस में टीबी प्रिवेंशन के लिए हेल्थ प्रोग्राम को प्रमोट करने के लिए केयर वर्ल्ड टीवी के मैनेजिंग डायरेक्टर मिस्टर अजीत गुप्ता ने कहा,
As you know, I represent a TV channel called Careworld, which is the only television channel in Asia working on health and wellness. I've been struggling for the last 10 years to put things straight, how to communicate to everyone in health sector. That is from beneficiary to functionaries and functionaries to beneficiaries. I have tried several forms and format and when I started working on health messages, I was new to the sector because I migrated from glamour industry. And every time I would think of creating anything, I would think in form of glamour, creating some dramatic impact, but it was not working. And I migrated from glamour industry to health industry only because of one reason, that it was a big challenge. Now, the only thing I wanted to share at this point of time is that I'm working on bridging gap between functionaries and beneficiaries. There has always been a passive messaging services in various forms and formats, but there has not been the reverse path to listen to what, or to evaluate the reaction of what has been conveyed. Now with the technology, we have developed a sort of platform which allows everyone to send their messages back. For example, we created a message saying, stop smoking. Now, how to stop smoking is a question, right? And there, someone needs some help from some expert.
इस एक दिवसीय कॉन्फ्रेंस में गेस्ट ऑफ ऑनर WHO रिप्रेजेंटेटिव टू इंडिया डॉक्टर नाटा मनाप्टी ने कहा,
We estimate that there are total 2.2 million incident TB cases in India. And what it means that nearly 1 million of those 2.2 is actually missing the notification, missing a detection. We don't find these people. The title of today's program is very ambitious and very laudable goal also, zero death. It's a big ambition for a disease such as TB. This is, of course, very much in consonance, in line with the new TB strategy and objectives and targets which have been set by the World Health Assembly as a way forward after 2015. And it also includes not just zero death ambition, but also to avoid the catastrophic health expenditure for TB patients and their families.
Tuberculosis is the disease of poor. Tuberculosis is the disease of person living in overcrowding condition, poor nutrition. What we have in our hand, we don't have the primary prevention. As a program, we have a limited resources. And we can reach to a certain level, but we need the help of everybody who want to work in this field.
इस कॉन्फ्रेंस में मुख्य अतिथि थे हेल्थ एंड फैमिली वेलफेयर सेक्रेटरी मिस्टर लव वर्मा, जिन्होंने अपने उद्गार व्यक्त करते हुए कहा,
First of all, I would like to congratulate ASSOCHAM for this very important conference, Getting to Zero. In fact, Getting to Zero seems to be chasing me all over the place, because when I was in Department of AIDS Control also, we used to talk about the 3 zeros: zero deaths, zero discrimination, and zero new cases. But here also we are talking of getting to zero deaths, which is a very big challenge. Our RNTCP program has been recognized as the largest and the fastest expanding TB control program in the world. So our goal is health for all. We are actually looking at a new health policy. We are looking at a national health assurance mission, and we are looking at a national e-health authority. We are going to initiate a number of new programs. They are all on the anvil. So we are in for very exciting times. But the thing which excites me most is the fact that we are going to make health a social movement. And in that, I think ASSOCHAM and other such industry organizations are going to play a great role. I once again congratulate ASSOCHAM and thank you for this opportunity.
I'd now like to invite Mr. D.S. Rawat, the Secretary General ASSOCHAM, to propose a vote of thanks.
We have a dedication, we have a commitment that to be associated and supplement the efforts of the Government of India on their commitment that पूरा कोर्स पक्का इलाज. And I would, in front of you, I would like to assure the dignitaries on the dais that the ASSOCHAM will be totally devoted and committed to supplement their efforts. We have already identified the industrial sector where we will be having these kind of workshops, awareness programs.
ट्यूबरकुलोसिस प्रिवेंशन प्रोग्राम में मेडिकल जगत की रिनाउंड पर्सनालिटीज ने गहरी दिलचस्पी दिखाई। साथ ही इस प्रोग्राम से जुड़ी जाने माने एनजीओज की हस्तियां, जिन्होंने ट्यूबरकुलोसिस प्रिवेंशन प्रोग्राम के विषय में अपने विचार व्यक्त किए।
The message that I would like to give over here is we have roughly about 2.3 million people getting infected every year. We know that the public health system is constrained and they can cover only up to about 1.5 million people. The additional 1 million that is coming is all going to the private sector. How is it that the private sector can step in and play a role in bridge the gap? We should also remember that in 80% of the cases, it is the private sector which is the first point of contact for any person who is likely to have TB. So look forward, the private sector would realize the role that they can play and how the corporate sector can also step in to support into this very important cause. So what we have done in polio, we can certainly replicate in TB as well.
TB जो है ये कैसे फैलती है, इसका इलाज कहाँ हो सकता है, इसकी जांच कैसे हो सकती है, दवाई कितने दिन तक खानी होगी और अगर हम नहीं खाएंगे तो उसका दुष्परिणाम क्या होगा, ये सब हमें जानना ज़रूरी है. Information is power.
TB is curable. There's no reason why in 2014 we should still have people dying of TB. We have the drugs, we have the diagnostics, but we are missing 1 million people suffering with TB. So we need to go on a war footing, we need to partner, we need to come together, which is why it's so exciting, and I really congratulate ASSOCHAM for organizing this. I think it's one of the first times that the private sector has come on board so strongly to join hands with the national program and taken every stakeholder on board. So I really look forward to seeing much more cooperation and joining of hands in making that zero TB deaths a reality in the near future.
I think this is a great initiative that has been taken, especially to create awareness about the TB control program. Not only is it important that people understand that everybody is vulnerable, therefore it is so important that people must identify if they have anybody in their vicinity who has a weak cough, that they should go for detection, and they must seek treatment and complete the whole treatment.
कॉन्फ्रेंस में आए विभिन्न क्षेत्रों के लोगों ने इस कॉन्फ्रेंस की सराहना करते हुए कहा,
The commonest symptom of tuberculosis is cough. So if you have got cough, you need to test yourself. It could be TB. You can do your sputum test in any of the government hospitals. You can do in a number of private hospitals also. But you need to diagnose TB early and then take the treatment properly. The treatment is minimum of 6 months. You need to take treatment regularly. If you miss the treatment, then the chance of developing drug resistance is there, and that is going to be a big problem. Then it is much more difficult to treat. So the way you can prevent spread of TB is diagnose early, help in diagnosing early by approaching a healthcare facility when you have got cough. That is the most important thing. If you have got cough, please go to a nearest healthcare facility to do a sputum test.
जहाँ तक अवेयरनेस का सवाल है, हम कम्युनिटी में बहुत ज़्यादा अवेयरनेस एकदम नहीं डाल पाएंगे. हम सिर्फ सबसे पहला एक मैसेज जो मोस्ट इम्पॉर्टेंट है वो है 2 हफ्ते की खांसी टीबी हो सकती है. अगर हम सब में से हर एक को ये मालूम है, पूरी कम्युनिटी को मालूम है, तो हमारे अंदर अपने आप इनिशिएटिव आएगा, मुझे 2 हफ्ते से खांसी हो रही है और ये टीबी हो सकती है, मैं जांच करा लूँ. दैट इज़ द फर्स्ट मैसेज आई वांट टू कन्वे. एंड द सेकंड मैसेज, अगर मुझे टीबी है और मैंने इलाज शुरू किया है तो मुझे पूरा इलाज लेना है जितने ड्यूरेशन का डॉक्टर ने बताया है। बीच में मेरा सब सिम्टम्स ठीक हो जाएं उसके बाद भी मुझे इलाज नहीं बंद करना है, मुझे वो पूरा करना है। जितने दिन डॉक्टर कहता उतने दिन का पूरा इलाज लगातार करना है, एक भी दिन छोड़ना नहीं, बीच में मिस नहीं करना।
एज ए कॉरपोरेट वर्ल्ड नेचुरली हर कॉरपोरेशन या कॉरपोरेट बॉडी ये चाहती है कि उसके एम्प्लॉयज़ प्रोडक्टिव हों, इफ़िशिएंट हों और उसके ज़रूरी है कि वो जो है वो रोग मुक्त हों। रोग मुक्त में सबसे बड़ा थ्रेट इस समय सारी चीज़ों का तो हम टेस्ट करते हैं, सबसे ज़रूरी चीज़ ये है जो टीबी जिससे लाखों लोगों की जान रोज़ जा रही है, जो कि कम्युनिकेबल डिजीज़ है, जो दूसरों को अफेक्ट करती है, इसको हम कवर नहीं करते। तो प्री प्लेसमेंट में अगर हम और पीरियडिकल जो मेडिकल चेकअप होता है उसमें हम देखें तो ये दूसरों को कम्युनिकेट नहीं होगी। दूसरा मैंने बोला है कि जो अनऑर्गेनाइज सेक्टर है उसमें 93 से 94% लोग काम करते हैं, उनको कोई भी पता नहीं लगता है कि इस प्रॉब्लम को कैसे हैंडल किया जा सकता है। इसके लिए अवेयरनेस हमें चलाना है और यहाँ पर हमें आप लोगों की, आपके मीडिया की बहुत ही ज़रूरत है। कंक्लूज़न ये निकलता है कि हमें हर जगह पर अपनी पहुँच बनानी है और उसके लिए हम रिमोट एरियाज़ में, बैकवर्ड एरियाज़ में, विलेजेस में जा कर के ये अवेयरनेस फैलाना चाहेंगे।
As we know that today we are talking the backdrop of a conference that has been organized by ASOCHAM on TB awareness and wellness program. IHPP works in various areas such as family planning, maternal health, HIV, TB, and our focus is really to develop partnerships with the private sector to take some of the work that we have done with the government forward under the CSR programs. If you want to partner for impact, you can talk to us, and we would like to partner corporate foundations, NGOs, and other organizations and individuals to spread the message about preventive health in these areas.
कॉन्फ्रेंस में टीबी प्रिवेंशन प्रोग्राम की रूपरेखा सुनिश्चित की गई।
पहले तो मैं केयर वर्ल्ड को बधाई देना चाहता हूँ। ये ऐसा चैनल है जो हेल्थ के बारे में बहुत अच्छे मैसेजेस दे रहा है। आज गेटिंग टू ज़ीरो डेथ्स टीबी को लेके एसोचैम ने एक बहुत बढ़िया ये कॉन्फ्रेंस किया है, जिसमें हम लोग ने कहाँ तक हम लोग पहुँचे हैं और कहाँ हमें आगे कितनी और कार्रवाई करनी है, विशेषकर एक्सट्रीमली ड्रग रेजिस्टेंट टीबी और ड्रग रेजिस्टेंट टीबी के जो केसेस आ रहे हैं उनको किस तरह से हम लोग को टैकल करना है उसको लेकर, और जो मिसिंग मिलियन केसेस हैं उनके बारे में भी बात चर्चा हुई है। तो किस तरह हम लोग अपने पूरे सिस्टम्स को स्ट्रेंथन कर सकते हैं, इसको लेके हम लोग आगे चर्चा बढ़ाएंगे।
I think events like this are very important in terms of bringing together various like-minded actors and leaders in the effort to control tuberculosis. I think it provides an opportunity for others to see innovative projects and things that are working, and to identify opportunities for partnering, which obviously if we work together, we can have a lot more impact than if we're all doing things differently. So I think it is a very important opportunity to come together and to learn from each other, and to, as a number of the speakers today emphasized, Secretary Verma and others, to really build a social movement to try to stem the tide and to really reach the goal of zero deaths in tuberculosis.
Seminars of this kind are very important. It's not just a seminar, let me be very clear here. It is an initiative which brings together various players, especially sectors which are not traditionally part of TB programs. So these are industries, these are researchers, these are academia, these are NGOs and civil society. So these are players who can A, help in increasing awareness, B, in helping to create conditions for TB to go down and reduce transmission. It is partners who are going to be working on new diagnostics, new vaccines. It is private sector who should actually step in, and with the ASOCHAM and players like this, we are going to hopefully see more interest, more engagement of private sector providers. So it's an initiative alone. It's not just a seminar where we talk to each other and get more clever and more knowledgeable about disease. It's about doing something together to combat this disease. And that's, I think, a very important initiative in this context.
इस कॉन्फ्रेंस के दौरान आयोजित पैनल डिस्कशन में हेल्थ जगत की रिनाउंड पर्सनालिटीज ने ट्यूबरकुलोसिस के उपचार और जन जागरण अभियान के विषय में चर्चा की।
The program has been able to make a significant impact on the prevalence and mortality due to TB, which have come down by almost half if you take the baseline as 1990. However, the incidence of TB continues to be the same. There's been very little change, although it is now showing a reversing trend.
As a NGO, we are not only treating the patients for tuberculosis, but we take care of other problems also.
इस कॉन्फ्रेंस में टीबी प्रिवेंशन के लिए हेल्थ प्रोग्राम को प्रमोट करने और इस विषय में स्टेक होल्डर्स के रोल को डिसाइड करने पर विचार विमर्श हुआ, जिसमें प्रिवेंशन प्रोग्राम में मीडिया के रोल को डिस्कस करते हुए केयर वर्ल्ड टीवी के मैनेजिंग डायरेक्टर मिस्टर अजीत गुप्ता ने कहा,
Actually, I have been practically looming to understand how best we can communicate, how effectively we can communicate and motivate the end user patient to take proactive decision to go to a test lab or take preventive care. Now, what has happened that there are two types of communication everyone has seen. A, purely information. A, this is happening, then this will happen, then this will happen, this will happen, and then communication ends. It could be done in 30 seconds, this could be done in 30 minutes. But I have seen some communication which are actually motivating the end user. Now, this motivation is like motivating them emotionally, that look, if you are not doing this, this will happen. Now, if you are touching someone's emotion, I say half the battle is won. I have seen the same thing in HIV, as you say. Emotionally, there were many emotional campaigns. I have seen travel between family planning to family welfare campaign, right? How everyone was disseminating information, and then finally everyone started landing into some sort of motivational messages. Now, I give you a small, right now I'm improvising in front of you, that there is a small child and a man comes home and says that, you are my best child, उसको गले लगाता है, उसको प्यार करता है, and suddenly someone said, आपने चेक कराया, आप इतने देर से खांसी हो रहे, अगर आपने चेक नहीं कराया, that means you don't love your daughter, right? I mean, I'm just trying to portray some sort of communication. Information will follow if there are motivational messages. Finally, for the last 2 years, I've been working on one concept, that let's take each problem as a product and let's market it properly. We all understand that marketing is very important. If I have to sell a toothpaste, right, I will not gift that toothpaste. I will not tell people, take this. I will not ask government to sell toothpaste on my behalf, right? But I will motivate people. I will talk about my product. I will explain about my product and sell my toothpaste. I am not comparing the problem, disease or anything with toothpaste, but I am talking about the concept. Now, if we treat TB as a product that people have to understand and they have to buy a test or they have to go for a process to prevent. I am not saying curative, I am not talking about curative market, I am talking about prevention. Now, if I create need to sell, to market, I have to create need. If I have created need, half the battle is won. But what is happening that traditionally, conventionally, we have been disseminating information and information and information, whether you are understanding or not. And then finally, what I want to say is that if there is anything, do I have any mechanism? I'm inviting all the stakeholders, please help us to create a back-end call center, right? There are every day thousands of inquiries landing in my channel. I don't know from where they are watching my channel, how they are watching my channel. The only thing I know is that Care World is watched by 50 million people, and out of 50 million people, someone will be having some sort of problem, and they keep calling us, and we keep diverting our calls, patients, to various other functionaries. But point is, how can we generate calls and inquiries about TB? That means we need a serious communication strategy, right? And once a serious communication strategy is in place, you will see that people will start calling, where to go, how to prevent myself. There will be a need. So we have to create a need. So to create a need, we have to work from macro level to micro responses. So that is something I need help from everyone, that to help us to design, to strategize communication, to educate people, to spread awareness and to motivate.
एक बड़े मकसद के लिए आयोजित इस कॉन्फ्रेंस में विचारों के आदान प्रदान के साथ ही टीबी प्रिवेंशन प्रोग्राम को लार्ज स्केल पर लॉन्च करने का फैसला लिया गया।
In this initiative, what SOCHM wish to propose at this moment? First, I would like to bring to your notice. Can I request Mr. Gupta to stand on my left? In fact, I would like to give a clap to him and request you all for a very specific reason that he has consented to pursue this cause. We have now decided a furtherance to this program, designing 360-degree healthcare communication strategy in CSR, launched by SOCHM in collaboration with Careworld Health TV. So thank you very much for your kind support.